are you doing?
Good, how you doing?
Good. My name is Bella. I'm going to be your nurse this evening. We're going to go over postpartum discharge instructions and instructions for your newborn baby. What's his name?
Ted.
Nice. That's such a cute name. Congratulations. If you have any questions while I'm going over the discharge instructions, just let me know, okay? Alrighty, so I'm going to start with mom care, everything you need to know. Again, if you have questions during this, just let me know. First, we're going to talk about the bleeding. This is called the lochia. It's normal to bleed for about 4 to 6 weeks. The first few days are bright red, like a heavy period, and then it turns pink, and then white-yellow before stopping. Any questions?
What if I bleed more?
That's when you would notify your provider. So if you bleed, if you saturate a pad less than an hour, you would call your provider, okay? So again, what's not normal? Soaking more than 1 pad in an hour. Call your physician if you experience this. If you're passing clots bigger than a golf ball, or if you're bleeding suddenly, if your bleeding is suddenly getting heavier, okay? And then for peri-care, you're gonna use warm water with the peri bottle every time you pee. Pad dry, do not wipe, change your pads often, and if you have stitches, they dissolve on their own. So ice packs and tucks will help with the swelling, okay? All right. And for breast care, whether you're breastfeeding or not, your breast may feel full or tender. Make sure baby has a good latch around the areola. Feed every 2 to 3 hours, air dry nipples, use nipple creams, and then mild discomfort is normal. And sharp burning pain is not. Do you have any questions? No? Okay. All right. If you're not breastfeeding, wear a tight-fitting bra, apply ice packs to the auxiliary area, and avoid stimulation. This is like what we do to stop the breast milk from coming, okay? As far as medications, you'll be going home with medications like ibuprofen or Tylenol for pain, stool softeners, Colace to help with that first bowel movement. If you had a C-section, maybe narcotics for a short period of time, and then continue prenatal vitamins if breastfeeding. Any meds for blood pressure or iron, keep taking as prescribed. Any questions? No? As far as activity, there's going to be no heavy lifting over 15 pounds. Take short walks. Avoid strenuous exercise or sex for about 6 weeks. If you feel dizzy or overly tired, stop and rest. Any questions? No? All right. Driving. You can drive again when you're not taking narcotics. You can move comfortably and slam the brakes in an emergency, usually around 1 to 2 weeks vaginal delivery or maybe longer after a C-section. Do you have someone driving you home today?
No.
No? Okay, so I would schedule to see maybe if your husband can take you home or drive you home, just because we want to make sure the baby's safe.
All right.
Okay, could you plan that? Okay, perfect. All right, so for the C-section incision, if you had a C-section, keep incision clean and dry. Pat dry after showering, no soaking in a tub until your provider says it's okay. Check incision daily for redness, warmth, opening, drainage, or odor. Do you know why we check for that?
Infections.
Good job. Okay, perfect. We learned something. So support the incision with a pillow when coughing or laughing. If there's any lacerations, a sitz bath will help. Ice during the first 24 hours. Keep the area clean. Watch for increased pain, foul odor, or opening of the stitches. Avoid sex until the incision is healed. Do you understand? Perfect. Okay, so infection signs and symptoms. This is what we've been talking about. Do you have any idea of what an infection will look like?
Yellow.
Yellow? Okay, that's...
Pussy.
Yeah, that's somewhere.
Smelly.
Yeah. Okay, so for infection, a fever over 100.4, foul smelling, see, you got that, severe abdominal pain, redness or swelling at the incision or perineum, or burning with urination. So if you have any of these signs, report it to your provider, okay? All right, now we're gonna go over postpartum depression. This is super important. Baby blues are normal for the first 1 to 2 weeks. Crying easily, overwhelmed, emotional, but postpartum depression lasts longer and feels heavier. Do you have any feelings of depression? No? Okay. Well, if your husband notices any of this, Just tell them to keep an eye on it, and then if it gets worse over time, that's something we would report to the provider, okay? And then again, call your provider if you feel hopeless, you're not bonding with the baby, you have scary thoughts, you don't feel like yourself. You are never alone, it's very treatable and nothing to be ashamed of, okay? All right. So when to return to doctor for checkup. You should have a checkup 2 weeks for a C-section incision, 6 weeks postpartum for everyone, okay? Awesome. Do you have any questions so far? No? He's so cute. Okay. So, symptoms which require immediate medical attention. Go to the ER, call 911 if you have heavy bleeding, soaking pads in under an hour, chest pain, shortness of breath, severe headache that doesn't go away, sign of a blood clot, warm, swollen leg, and severe abdominal pain, okay? Do you understand? Okay. And then again, thoughts of harming yourself. Do you have any questions about care for yourself?
No.
No? Okay, so now we're gonna go into newborn care. So I'm gonna first talk about breastfeeding, formula fed. Are we doing breastfeeding? Are we doing formula?
Breastfeeding.
Breastfeeding? Okay, perfect. So with breastfeeding, you should eat every 2 to 3 hours. So you should feed the baby every 2 to 3 hours, 8 to 12 times in 24 hours. But if you were considering doing formula sometimes, every 2 to 3 hours, never prop the bottle, warm bottle safely, no microwaving. Do you understand? Okay, so normal daily output, wet diapers should be increased each day, measured by weighing. First, poops are black, sticky meconium, then greenish, then a yellow seedy if breastfeeding. Umbilical cord care, the cord will naturally crust and fall off within 1 to 2 weeks. Keep it clean and dry, fold diaper below the cord, and then call if the color is red, foul smelling, and if there's discharge. Do you know what that means? Infection. So sponge baths only if it has fallen off. And yeah, okay. So bathing and skincare. Baby needs 2 to 3 baths per week. More baths can dry out their skin. Sponge bath until the umbilical cord falls off. Use mild soap. Never use lotions with fragrances. Never leave the baby alone near water. Okay. Do you have any questions? Are you sure?
Would Cetaphil be alright?
I would just use mild soap, preferably a baby soap. So you can find that in the baby aisle section. Okay? And then also we have some recommendations here, so I'm sure I can show you some bottles. So now we're going to talk about shaken baby syndrome. Okay. This can happen from shaking a baby even once. Put baby in a safe place. Call someone for help. Step away. Never shake the baby under any circumstances. Do you understand that? Even if you're handing your baby over to other family members, just make sure they're aware not to shake the baby and to handle them gently, okay? So safe sleep and SIDS. Do you know what SIDS is? Have you heard of it? This is an unexpected death of a newborn, so it's very, this is just prevention that we could do. Always place the baby on their back, share rooms, but never in the same bed, so you want them separate. Firm mattress, fitted sheet, no blankets, toys, or pillows. No smoking around the baby, and then have the baby use the pacifier in bed, okay? Okay. Any questions? Thermoregulation, so now we're going to talk about the newborn temp. They tend to get cold very easily because they have less subcutaneous fat. So it's very crucial that we keep them at the right temperature. Do you know what that temperature is?
97.6.
Close.
Not 0.8.
It's 97.
0.9.
It's 97.7 to 99.5. So we can measure this axillary, so under their armpit. Don't be afraid because the baby never likes the armpit temperature, and then sometimes we'll do rectal temperature. If the baby is too cold, too hot or cold, dress baby in one more layer than you. Avoid overheating. If fever over 100.4, that's an emergency in a newborn. How to assess a temperature. Again, you can do the auxiliary thermometer, and then place under arm, hold the arm down, and wait for a beep. Do you understand?
Mm-hmm.
So you place it on the arm, put their arm down, and wait for a beep, okay?
Mm-hmm.
So avoid rectal temps unless the provider instructs you. And then for newborn jaundice, that is the yellowing of the skin or the eyes. Call a doctor if the baby looks more yellow, the baby is very sleepy and won't eat, not having enough wet diapers. Feedings can help clear jaundice with more frequent wet/dirty diapers, okay? So the more that the baby eats, the more that the baby is going to pee and have dirty diapers.
Mm.
So then the jaundice just naturally gets out of their system. All right. So I'm actually gonna go over circumcision care since we have baby boy Ted over here. If the baby is circumcised, keep the area clean. Have you gotten Ted circumcised? Not yet? Are you planning?
Mm-hmm.
Okay. Well, once the baby is circumcised, you're gonna keep the area clean. Use Vaseline so diaper doesn't stick. A yellow crust is normal. Call if there is bleeding bigger than a quarter or signs of infection. Do you know what signs of infection look like?
Yellow.
Red, swelling, fever,
Mm-hmm.
pus, any of that. Now I'm gonna go over car seat safety. Do you have a car seat purchased already for the baby? All ready to go? Perfect. So the car seat must be rear facing. In the back seat, strap snug, chest clip at the armpit level. Infection control, always wash your hands before touching the baby and have other family members wash their hands as well. Limit visitors, especially if they're sick. The babies have a weakened immune system, so it's crucial that you keep them away from people that are sick. Any questions?
No.
Okay. So now we're going to talk about airway clearance. If the baby spits up, turn baby to the head to the side, bulb suction, squeeze first, then release into the cheek. And then again, signs of infection in a newborn. Fever 100.4 or higher, poor feeding, lethargy, rash, trouble breathing, fewer wet diapers. Okay?
Mm-hmm.
And then symptoms that require immediate medical attention. Go to the ER for the baby stops breathing, turns blue, has a fever 100.4 or higher, vomits green fluid, has a seizure, or has signs of dehydration. What would you expect in dehydration?
Dry mouth.
Oh yeah, good. You actually got it. Good. Okay. So we've learned a lot. Sunken soft spot, dry mouth, no tears. So just always stay hydrated. I love that. Perfect. So now we're gonna do a routine follow-up appointment. The baby should see their pediatrician within 48 to 72 hours after discharge and then regularly for weight checks and vaccines, okay? All right. Closing. The last part. That was a lot of information. You're doing amazing. If you have any questions. So we just went over all the discharge instructions. Do you have any questions?
No.
Are you sure? I'm gonna go over all the steps. Not like one by one, but I'm just gonna briefly go over it and see what we remembered, okay?
So,
All right. So what do you know about care for yourself?
put nipple cream on. They're gonna be tender. Keep them clean, air dry them.
That's so good. Okay, do you know anything about breastfeeding? Like, if you're not planning on breastfeeding?
That they're gonna be tender. That they're gonna hurt. That might leak. And that I need to
Put ice packs.
ice pack
Where?
on the areola. Underneath my armpits.
Good job. And then, what is not normal that you will see?
Redness.
Okay.
Like incisions.
Perfect. You're doing amazing. Okay. And then medications. What are you gonna expect?
What am I gonna what?
Like for pain.
Tenderness in the nipple.
No. Like, what are you gonna take for a medication?
Advil and ibuprofen.
Okay. Yeah. Good job. And then we do give stool softeners. Do you know why? because after giving birth, it might hurt in that area. So the stool softeners might be a little more comforting for you. Perfect. And then as far as activity, are you not going to lift over how many pounds?
15.
10 to 15, but yeah, perfect. You're going to take like short walks. Just keep it slow, and then once you feel ready and then the provider approves, we'll be good, okay? As far as driving, again, did we figure out that ride? Perfect. And then sit spots can help. And then a fever over what? For infection.
100.4.
Perfect. Perfect. And then as far as postpartum depression, do you know the difference between postpartum depression and baby blues?
After 2 weeks.
Yeah, so baby blues is going to be the first 1 to 2 weeks, and then it resolves on its own, okay? The difference with postpartum depression, it can last longer, up until months, and it can be more severe. So again, normally your husband will expect the typical crying, mood changes, mood swings. But after that, if it's still continuing, that's when we'll like to notify the provider about it. So yeah. And then we're gonna do a checkup around like 2 weeks, 6 weeks postpartum. So around 6 weeks, you're gonna have that because you had a vaginal delivery, correct? All right. So now, again, if you have, we like to call it aches. These are symptoms that require immediate medical attention. So that's where you have the severe headache, which is the H, blood clot, abdominal pain, shortness of breath, chest pain, heavy bleeding. So do you know when to report that? Okay. And then newborn care, how many times should you be feeding your baby?
8 times a day.
That's good. Yeah, how many hours between? 2
to 3.
Perfect. And then as far as the umbilical cord, just want to be super gentle with it. You're going to have to fold down the diaper. You don't want the diaper touching the umbilical cord. The umbilical cord is going to fall off by itself. So it's like crusty, and it's going to crust off in 1 to 2 weeks, okay? So just be careful. Make sure you put like Vaseline, Aquaphor in the diaper just to help. Mild baths, we talked about that. I gave you an amazing soap to try, right? Perfect. And then what do we not do for a baby? We don't shake them.
Shake them.
Yes, yes, yes. Okay. And then as far as SIDS prevention, baby's gonna lay on their
back.
They're gonna have a pacifier. What else?
Let's see.
No smoking.
Hard mattress.
A fur. Yeah, there you go. Awesome. Okay. We have like a couple things to go over. I just want to make sure that we retained information before I send you home. Again, I'm going to send you home with this, okay? So you're going to have the whole sheet. You'll have it to refer to. If there's any problems, feel free to reach out. Call us if you need us, but we are here. Okay. But yeah, circumcision care, clean, Vaseline on diaper, yellow crush is normal. And then jaundice, we just did testing. The blood types are compatible, so we didn't see jaundice on your baby, so you should be fine, but just to monitor, make sure your baby's not yellow, okay? And then normal temperature, make sure you keep them warm and snug all the time. Don't keep the crib next to a window. It's very cold, especially these months. But yeah, if you have any questions, I'm gonna send you home with this pamphlet. I'm going to pack some soaps and some care items for you to bring home with the baby. Again, if you have any questions, just let us know. Congratulations on your new baby. But yeah, make sure you reach out if you have any questions, and I'm gonna give this to you.
Nice.
All right.